Hello, my name is Penny Nixon. I'm a specialist pelvic health physiotherapist. Today I am doing a presentation for patients who are about to have surgery for a radical prostatectomy. My mission today is to teach you really all about the pelvic floor. We have a presentation for you which will be on the website as a clear presentation to follow alongside this video, so hopefully you'll be able to read it all easily. So my mission is to teach you pelvic floor exercises. So why is it so important to learn how to do pelvic floor exercises when you're having a radical prostatectomy? Well, some patients have some symptoms regarding the bladder preoperatively. You might have symptoms like dribbling, or the needing to rush to the toilet, the needing to visit the toilet frequently, having to get up frequently in the night to go to the toilet, or sometimes leaking on exertion, so doing things. Some patients don't have any of these symptoms at all preoperatively. The pelvic floor has three main functions. It has a supportive role, so the muscles sit right down in the base of the pelvis and support everything that sits above it. It has a major role in continence, which will become very clear with the pictures that I'm going to show you later on, and also has a role in sexual function. So there are two superficial muscles that help with this. One stops the backflow of blood, and the other actually helps to support the erectile tissue itself. This is a picture of the whole abdominal cavity. So the pelvic floor muscles actually sit right down here, right in the base of the pelvis. They work as part of a team with the deep tummy muscles, the diaphragm, the breathing muscle, and little muscles that live between each section of the spine called multifidus. So we know that these muscles work well together. So when you're sitting, standing or exercising, think about the posture that you're holding, and then you will automatically be engaging the pelvic floor muscles as well. So sit up nice and straight as if your mum would be proud of you, and that is probably a better position and will be encouraging those muscles to be working. The pelvic floor muscles work in tandem with the diaphragm. So this is illustrating that when you breathe in, the diaphragm and the pelvic floor muscles drop, and when you breathe out, the pelvic floor and the diaphragm will lift. So lovely relaxed breathing as you're doing your pelvic floor muscles is really very important. This is a diagram of the male pelvis chopped in half. So we're going to label it. So that's the sacrum, so that's the bony bit at the back. The pubic symphysis, which is the bony bit at the front, the bladder, the bowel, prostate gland, and the urethra or the water pipe. Now we're going to peel this back a little bit further to show the sphincters. So this is the bladder neck sphincter. So it lives between the bladder and the prostate gland. So when the prostate is removed, this sphincter is likely to be damaged. So we have a secondary form of continence. It's called the urethral sphincter. This one lives just below the prostate gland, and it is surrounded by the pelvic floor muscle. So when you engage the pelvic floor muscle, you squeeze around the urethral sphincter, and it's a little bit like putting your foot on the hosepipe, so stopping that flow. So all of you chaps will have been working these pelvic floor muscles all of these years without even noticing, just on autopilot. You know when you jump into a freezing cold sea and you go and you're trying to lift the crown jewels as far as possible out of the cold water, that is your pelvic floor that's doing that function. Or if you're stuck on the motorway and you're desperate to go to the toilet and you need to hang on for dear life, it is those pelvic floor muscles that are doing that action for you. So imagine that you're stuck on the motorway and you've got to hang on for dear life, and you should feel a little bit of a lift underneath your bottom where you're sitting, behind the scrotum, and then relax those muscles. I don't really mind which command works, nuts to guts, testicles to spectacles, or in research we found that the command imagine you're trying to shorten the penis, so drawing the penis in, lift behind the scrotum, and then very gently tighten around the back passage. By doing those 3 actions, you're going to gain the full muscle action. So I'll just talk you through that one again. Imagine you're trying to shorten the penis, so drawing in, lift behind the scrotum, and gently tighten around the back passage. To remind you what you're doing, you're engaging the pelvic floor muscle, which is here, which is squeezing around the urethra and the urinary sphincter to stop that flow of urine. What we don't want to see when you're doing this muscle function is we don't want to see shoulders lifting, eyebrows lifting, toes lifting, clenching your bottom muscles, or any funny faces. Nobody should know that you're doing this muscle action, should be able to do this completely in private. This is what it looks like when the prostate's been removed. So the 2 little red dots that are there, that's now the urethral sphincter that's been drawn up to the bladder, and that's still surrounded by the pelvic floor muscle. So it's still going to have the same function for you. Now we need to vary the workout. So we need power, endurance, timing, and speed. So power contractions. In sitting with your great posture, you can do 10 pelvic floor lifts. So pelvic floor lift, and then relax. Pelvic floor lift, and then relax. Pelvic floor lift, and then relax. And you can repeat that 10 times. We know that in research, in fairly recent research, that actually doing your exercises in standing, you are going to get better effect, and doing them 6 times a day, you're going to get better effect. The old guidelines used to say 3 times a day, doing 10 contractions of each, and you could do them in any starting position, and that works, but you'll get a better effect in standing 6 times a day. So if you do some in standing, you can do some with your toes turned out. So if you try, turn your toes out in standing and do a pelvic floor lift and relax, and lift and relax, and lift and relax. Now turn your toes in and do the same again. So pelvic floor lift and relax, pelvic floor lift and relax, and pelvic floor lift and relax. And then toes straight, and this gets the whole muscle working. So pelvic floor lift and relax, and lift and relax, and lift and relax. And doing these with the different foot positions, you'll feel a different emphasis whether the front of the pelvic floor is working or the back of the pelvic floor is working. So varying the workout is a really good idea. So 6 times a day, preferably in standing. Now, they're not very difficult to do once you've found these muscles, but remembering to do them is pretty tricky. So linking them to an activity is really helpful. So it could be teeth and meals, it could be visiting the toilet, so go to the loo, wash your hands, do your exercises. You could set your phone to bleep, or there's a really good app called Squeezy for Men. You could download that on your phone, or you could ask somebody to remind you. Now we're going into endurance contractions. These are a long, slow hold. They don't need to be done at the maximum contraction. So this is about a third lift, and then a long 10 breathing cycle hold. So I'll just do one with you. So pelvic floor lift, but gently, then hold and breathe. Keep it going. Keep breathing and holding. Keep it going. Keep breathing and holding. Keep it going, keep breathing and holding, keep it going, keep breathing and holding, and relax. So the aim is to do 10, holding each one for 10 breathing cycles. And don't forget to relax the muscles afterwards. So we want you to do 10, holding each one for 10 breathing cycles, preferably 6 times a day. But you can also do some ad hoc ones. So if you're standing in a queue waiting to pay for something, or sitting in the car or riding your bike, then you could do a long contraction or a few short ones. Then the neck. This is about using the muscles at the right time. So when we increase our intra-abdominal pressure, we need the pelvic floor to be switched on first. So when we cough, sneeze, laugh, lift, push, pull, we are exerting ourselves and we need that pelvic floor to be switched on. So we're going to have a try with a cough. So engage your pelvic floor muscles, hold them on, do a cough, keep that pelvic floor on, and then relax. You can also try with sitting to standing. So pelvic floor on, then stand up, keep that pelvic floor switched on, and sit down. So any activity post-op where you find you're actually leaking, you could break that down into an exercise and really think about engaging your pelvic floor first before actually doing that activity. If you let the pelvic floor go a little bit too early, then this bright blue triangle on the right will be the potential leaking zone. Now we need to be able to find these muscles pretty quickly. So I'm going to say ready, steady, go in a moment, and I want you to see how many pelvic floor contractions you can do in 10 seconds. We are not talking quality here, we are talking speed. So ready, steady, go. And stop. How many did you manage? You're aiming for 14 contractions, which is quite a lot in 10 seconds. So if you didn't manage very many, then that one is worth practicing as well, because you need to be able to switch these muscles on really quickly. So to summarise the exercises, we're aiming for 6 times a day in standing, just linking into the recent research. So power contractions, either doing just some straight lifts, doing 10 repetitions, or a mixture of toes in, toes out, and toes straight. The endurance contractions, these are the long, slow holds at just a third of the capacity. So a gentle lift and holding for 10 breathing cycles, 10 repetitions, 6 times a day. And the knack, this is about using the muscles at the right time. So you can practice in your day-to-day life thinking about which activities you might be a little bit vulnerable in, and practice using the pelvic floor muscles. And then the speed challenge, so having a little go at finding the muscles quickly. So we want you to start exercising now. You have a rest as soon as your catheter is in place, but as soon as that catheter is taken out, you will be reminded to get started again on those exercises. Now, if you do get sore or tired down in the pelvic floor region, then have a rest. These are muscles like any other, so if you've overdone a gym program, you don't go the next day and do exactly the same. So have a rest until those muscles have recovered, and then you can start your program again. Now, we wanted to remind you also about normal bladder habits. It's very tempting when you've had this sort of surgery to spend half your life in the toilet making sure your bladder is empty. If you do that, your bladder muscle will start to complain. So we want you to really maintain normal bladder habits. So normal input is drinking 1.5 to 2 litres in a day and visiting the loo 3 to 4 hourly. So if you're visiting the loo a lot more frequently than that, then you need to think why. Is it because you've got an infection and your body is telling you need to go quickly? Or is it because you're just visiting that loo to empty your bladder and therefore not allowing your bladder muscle to fill up properly? If you want to check whether your bladder is misbehaving or not, it might be worth doing a fluid volume chart, so you can look at what you're putting into your bladder and what you're avoiding. And a little bit later on, I've got a picture of a fluid volume chart to show you what a perfect fluid volume chart would look like. So if your bladder is misbehaving a little bit and it's telling you to go to the loo a little bit too often, there are a few things that you can do to help. The first is avoid drinking caffeine, anything fizzy, fresh fruit juice or alcohol. The next is make sure you're drinking enough, so make sure you're drinking 1.5 to 2 litres. Make sure you're not doing what we call just-in-case visits to the toilet, so just nipping into that little room because your brain's telling you it's a good idea. And then you can do what we call deferment techniques. So this is trying to put off the visits so that you stretch the visits out, aiming to get your 3-hourly visits back. And there's a few tips and tricks to help you with this. The first is you get the message you need to go to the toilet and you just stop and breathe. The next thing to do is to sit, cross your legs, tap your feet, or if you're standing, you can go up and down on your toes. The next thing to do is to do a really good pelvic floor contraction. And finally, think about something else that can make a big difference as well. We need to also think about the pelvic floor has the bladder and the intra-abdominal contents sitting above it. The bladder goes from empty to about 500-600 mils. As the bladder is filling up, the pelvic floor is taking on a little bit more tone. So that's another really good reason to keep normal bladder habits going, so that pelvic floor function behaves normally too. This is a perfect fluid volume chart. So the left column is input, and we've got 6 drinks at 250 mils each, spread out quite nicely during the day. Then we've got output. What we normally see is the biggest void of the day first thing in the morning, and subsequent voids at 3-hourly intervals will be half that capacity. So here we've got 500 mils first thing in the morning, and at 3-hourly intervals about 250 mils. Now, expectations, this is actually a really important slide. Tissue healing takes 12 weeks. So you are very likely to leak post-operatively, and we see everything from a few drops to the full Monty. By 6 weeks, we see a big improvement in the mornings and overnight, but everybody then gets cross in the afternoon because that leaking reoccurs, and we think that is because of fatigue. After 3 months, we see a massive improvement which links with our 3 months, 12 weeks tissue healing time, and by a year, 90% of men are dry. As improvement occurs, we want you to start ditching the pads so they don't become a bit of a safety blanket, and also then delay putting the pad in the next morning. We've been asked to warn you about activities as well. You're not going to want to be sitting on a hard surface for about 8 weeks. You want to avoid driving for 2 weeks and avoid lifting, straining and gym work for at least 8 weeks. So you could go back to the gym at 8 weeks, but we're talking treadmill and cross trainer, no weights. This slide usually gets people thinking about their work. If you're doing a manual job, then you're going to need more time off work than somebody sitting at a desk, because you don't want to strain on that mend down by the urethra. We also mention about fatigue and depression. For some of you, this will have been a very speedy journey to this point, and it's not until afterwards that it sort of all hits. So we're very, very lucky at Addenbrooke's to have the Maggie Wallace Centre with a fantastic counselling service. So if anybody needs that, then please go and visit Maggie's. We also want to promote good healthy living. Any general exercise, when you hold a really good posture, will encourage that pelvic floor to be working. We also know that it gets the endorphins released, so it makes you feel better. So when you're going through a pretty rubbish time, we want as many endorphins floating around your body as possible. And because we live in Cambridge, we need to talk about saddles on bikes. Everybody wants to be back on their bike. So there are some saddles that split in two, so there's a little bit of a gap underneath. But in essence, you're not going to want to be sitting on a saddle for a couple of months. We want to encourage you to maintain good, healthy nutrition to avoid constipation, and also to stop smoking. Smoking will affect your healing time and also bone density. There is a lot of evidence about the effect of exercise on a cancer diagnosis. And because of this, we have a fantastic service at Addenbrooke's called React, run by a physio called Nicola Day. You're all welcome to get in touch with Nicola and organise to join in the React sessions. If you don't live locally, then she can advise on your more local services. So that's my bit, so good luck with your pelvic floor training.